prayers, salam, and my duas for everyone's safety and well-being. COVID-19 pandemic is an unprecedented challenge for our communities. We as healthcare providers are at the front lines, putting our lives and those of our families at risk. APPNA's Executive Committee, Social Welfare and Disaster Relief Committee under the leadership of Dr. Aisha Zafar and the COVID-19 Task Force have been working hard to address the need. My thanks to them and our membership for their generous donations and support. We have commitments of more than $120,000 with more coming. We are trying to get these funds quickly to areas of need. Our relief efforts in US and Canada have focused on food assistance in collaboration with APPNA's 35 food pantries. We have provided them with $12,000 for immediate relief to the families affected by COVID-19 in US and Canada. Our members are on the front lines treating COVID-19 patients or trying to keep other patients safe by changing our clinical practices to televisits. There is a national shortage of personal protective equipment for healthcare providers. We need our voices heard loud and clear at state and federal levels, reaching our elected officials so that adequate PPEs are available for all healthcare providers. For Pakistan, we have a three-pronged approach. Firstly, food assistance for large population subsisting on daily wages impacted by the lockdown. In Pakistan, our initial goal was to provide rations to 5,000 families. With Selani Welfare Trust, we have provided food rations to 1,550 families. We are also working with the Hoa Trust and have provided food aid to 1,000 families. Number two, helping the health professionals in Pakistan. There is a lack of personal protective equipment, ventilators, portable X-ray machines, and PCR testing kits. Our committees have been regularly meeting with the Pakistani ambassador, His Excellency Asad Majid Khan, and his team, as well as Pakistan's National Disaster Management Authority to figure out the best mechanisms to get the required items to our Pakistani teaching institutions. We are also identifying vendors in Pakistan, and we will work with the vendors both in Pakistan and in China, approved by NDMA, to purchase the required equipment, and then with their collaboration, have them delivered to major hospitals affiliated with our alma maters. Each ventilator can cost $20,000 to $40,000, so the need for funds is great. Thirdly, teaching, training, and awareness. With the collaboration of RISA and APPNA Merit Committees, we are developing the following for Pakistan. Number one, clinical guidelines on how to deal with COVID-19 patients. Number two, sharing of clinical experience in the management of the COVID-19 patients. Number three, providing education for ICU support for COVID-19. APPNA doctors have been active on TV and social media for awareness. Lastly, Pakistanis are stranded during the COVID-19 epidemic. Pakistani residents matched for residency in 2020, there are more than 200 young physicians who will be facing the challenge of not being able to join their programs on time, as US Embassy and consulates are closed for visa. There are also Pakistani Americans who are stranded overseas. APPNA Executive Committee and Advocacy Committee is reaching out to ECFMG, US State Department, and the US Ambassador in Pakistan, with whom I met earlier this month in Islamabad, to advocate to solve these issues. I am very proud of the work APPNA's 49 chapters and alumni organizations are doing to mobilize, advocate for PPEs for healthcare workers, donate to their alma maters, help local soup kitchens and food pantries in US, Canada, and Pakistan. APPNA will match funds for these food donations. Please be safe. Let's all work together to help our communities cope. Donate generously. Let us all pray that this pandemic will pass soon and we will all come out of this stronger together. Inshallah.